When my wife was pregnant, she had severe nausea. So it was just awful. Her doctor was saying, here's a prescription. And we asked the doctor, what's the risk? And the doctor said, well, we're not sure. But if you take a little bit, there's less of a risk. And then she developed some hives as well. And so we seeked out and found a nurse practitioner that was also trained in the integrative approach to medicine. And we would drive 45 minutes out of Oregon into Washington every time. She had a super busy practice. And it was all because when you go to see her, she offers you more solutions than just the drug, right? And my wife did not want to take the drug. And so she recommended her to do ginger tea, and it worked. So I got her ginger tea and I got her this little ginger spray. It's just a liquid ginger, and she would use it, and it helped. I would say, close to 100% reduction in her nausea. So it was really great. It was a lifesaver, right? So ginger, we know ginger as a natural spice. It's used in diverse regions. Ginger has been used in herbal medicine also for centuries. And there was an interesting systematic review that reviewed over 100 studies regarding the different effectiveness of ginger. And what they found is what ginger was helpful for several subsections as they categorize it, which was nausea and vomiting, and then gastrointestinal function. That could be bloating after meals, problem with absorptions. That could be even chronic pain. That's the third subsection, pain and inflammation. And then metabolic syndrome, for example, glucose imbalance, diabetes type 2. So when you think about this, when you help a patient to balance their metabolics or improve their metabolics, support healthy gastrointestinal function, and reduce inflammation, you're already gonna probably impact multiple conditions, from different cardiovascular conditions to autoimmune conditions. Ginger could be very, very beneficial as a supportive therapy. It's also good when you think about patients with chemotherapy and they got all that, you get that nausea and vomiting. That could be also helpful as well. Of course, you have to consider each case separately, but that's the recommendation. Typically, the daily dosage that we're looking at for reducing inflammation and metabolic conditions, it's typically, most studies will use between 500 milligrams to 1.5 grams per day, right? So that could be 500 milligrams divided into 2 dosages, or 1 gram divided into 2 dosages of morning and evening. It's better to take this with food so it doesn't cause any stomach irritation. Now, what are some of the other impacts that we can see with ginger? I wanted to bring you this really interesting picture that talks about the mechanisms, because when we understand the pharmacology of a certain herb, it helps us to better personalize the treatment plan for each patient. And you can see cardamom and turmeric up there because ginger is a part of the same family as turmeric and cardamom. So on top, you can see anti-inflammatory properties, was found to be associated with the reduction of C-reactive protein, IL-6, 2-necrosis alpha, inhibit COX-2. And then on the left side, you can see it's antioxidant, also anti-cancer properties, induce cellular apoptosis, neurodegenerative diseases, right? So increases the master antioxidant glutathione, which is really important for protecting our cells, increase nitric oxide. And then we have on the right bottom side, we got cardiovascular disease prevention. So ginger was actually found to support reduction in blood pressure. And then we also have reduce in cholesterol accumulation in macrophage foam cells. So that's a part of that inflammatory process that I talked about earlier that is responsible for arteriosclerosis, right? The development of arteriosclerosis. Remember, it's not just cholesterol, it's also the inflammation and the overactivation and migration of those immune cells and macrophages and the formation of foam cells, right, in the arteries, which is causing that plaque to build. And on top right, we got antiviral, antifungal activity. We know that ginger also have microbial activity, which is also great for if a patient has a dysbiotic gut microbiome, then ginger could be one of those supportive agents to help. So if you want to read more about this, this was published just recently, 2023. It's called Antioxidant Activity in Extracts from Zingiberaceae family. Good luck saying that 4 times. Cardamom, turmeric, and ginger. And this was published in journal Molecules. And I posted the citation on the right side, so you can read this. Now, we wanted to bring you to show you there's different ways to integrate this, of course, into patient's diet. The easiest way, of course, is to take a supplement, right? You buy a supplement, hopefully from a professional grade company. That's something that we put a lot of emphasis in our advanced functional medicine program. We even have a whole class on how to pick your labs and how to pick your supplements, professional grade, just to make sure that you're getting what's on the label is in the capsule, right? Or what's in the capsule is actually what's on the label. There's also fun ways to integrate this, because some of these as spices, they can be used, for example, in different dishes. So here's a picture of a carrot ginger soup, super healthy, super fun. It's got some olive oil, diced onion, garlic, 3 tablespoons of ginger that is minced or finely diced, a little bit of carrot, and a little bit of vegetable broth. Pretty simple to make. It's literally just stir fry the ingredients, and then cook for 20 to 30 minutes. Pretty straightforward. Looks delicious. One of the cool things that I always try to do when I cook it in my house for my wife and our daughter is look for how can I integrate these ingredients into delicious meals. So I like to experiment and find, and thankfully today in the tips of your fingers, you got recipes pretty much for everything, right? But it's just to give you an idea.